over 60? Here's why you always have mucus in your throat. Doctor explains. Before you clear your throat again, I want you to do something. Swallow once. Just once. Now ask yourself this question. Why is that feeling still there? Why does it feel like something is stuck in the back of your throat no matter how much water you drink, how many times you cough, or how often you clear it? If you're over 60, what I'm about to tell you may completely change the way you think about this frustrating symptom. Because persistent throat mucus is often not the problem itself. It's a warning sign, a clue, a message from your body that something deeper may be happening. And here's what concerns me most. Millions of older adults are treating the symptom while completely missing the cause. They buy throat lozenges. They try home remedies. They carry water bottles everywhere they go. Yet the mucus keeps coming back. Day after day, week after week, month after month. Stay with me because today I'm going to reveal 5 research-supported causes of persistent throat mucus in adults over 60, including one cause that has absolutely nothing to do with your throat and another that may be hiding inside your medicine cabinet right now. Most importantly, I'm going to explain why 2 of these causes often occur together, creating a cycle that makes symptoms dramatically worse. Before we begin, please take a moment to subscribe to the channel and turn on notifications. Every week we share evidence-based health strategies designed specifically for older adults who want to remain healthy, active, and independent for as long as possible. Also, I want to hear from you. Is your throat mucus worse in the morning or does it stay with you all day? Type morning or all day in the comments below. Believe it or not, your answer may reveal one of the root causes before we even begin. Now let's talk about something that most people never hear from their doctors. Mucus itself is not your enemy. In fact, mucus is one of your body's most important defense systems. Every day your body produces mucus to trap bacteria, viruses, dust, allergens, and harmful particles before they reach your lungs. Without mucus, your airways would become dry, irritated, and vulnerable to infection. The problem isn't mucus. The problem is why your body is producing too much of it and why it seems impossible to get rid of. To understand that, we need to talk about aging. Inside your airways are millions of microscopic hair-like structures called cilia. Think of them as tiny cleaning crews working around the clock. Their job is to move mucus out of your throat and lungs before you ever notice it's there. When you're younger, these cilia work incredibly efficiently. But as we age, they begin to slow down. Research shows that mucus clearance becomes less effective over time. This means even small increases in mucus production can suddenly become a major annoyance. What would have been cleared within minutes at age 40 may linger for hours at age 70. Understanding this one fact helps explain why persistent throat mucus becomes so common later in life. Now let's talk about the first cause, and in my experience, it's one of the most overlooked. It's called silent reflux. Most people assume acid reflux always causes heartburn. But silent reflux is different. There may be no burning sensation at all, no chest pain, no obvious digestive symptoms. Instead, small amounts of stomach acid travel upward during sleep and reach the throat and voice box. The tissues in these areas are extremely sensitive. Even tiny amounts of acid can trigger irritation. When that happens, your body immediately responds by producing more mucus as a protective barrier. Let me tell you about a patient I once met. She was 72 years old and had been clearing her throat every morning for nearly 3 years. She thought it was allergies. Her family thought it was aging. She had tried every remedy she could find. But when we looked closely, a pattern emerged. Her symptoms were always worst when she woke up. She often ate dinner late in the evening. She sometimes experienced a mild sour taste in her mouth during the night. The problem wasn't her throat. The problem was silent reflux occurring while she slept. Within weeks of making targeted changes, her symptoms improved dramatically. Here's the important lesson. If your throat feels worse in the morning, if your voice sounds raspy when you wake up, or if you constantly feel the need to clear your throat shortly after getting out of bed, silent reflux may be playing a larger role than you realize. But don't assume you've found the answer yet, because what comes next often works together with silent reflux, making symptoms much worse. The second cause is postnasal drip. Now, when most people think about sinus problems, They imagine severe congestion, facial pain, or headaches. But in older adults, chronic sinus inflammation is often much quieter. Your sinuses may produce excess mucus without causing obvious symptoms. That mucus slowly drains down the back of the throat throughout the day. You may not even realize it's happening. All you notice is the constant sensation of mucus sitting in your throat. Here's where things become interesting. Many people spend years treating postnasal drip with over-the-counter medications that temporarily dry out mucus. Unfortunately, this often makes the mucus thicker and harder to clear. Instead of solving the problem, they make it more uncomfortable. Studies continue to show that simple saline nasal rinses can be surprisingly effective because they physically remove excess mucus while supporting the natural cleaning process inside the nasal passages. But before I tell you why most people use saline rinses incorrectly, let's move to cause number 3 because this one surprises almost everyone. In fact, if you're taking medication for high blood pressure, you need to hear this. Some of the most commonly prescribed blood pressure medications in the world belong to a group called ACE inhibitors. These medications save lives and help millions of people control hypertension. But they also have a well-documented side effect. They can cause persistent throat irritation and chronic throat clearing. The reason involves a substance called bradykinin. When bradykinin accumulates, it can irritate sensitive tissues in the throat, creating an almost constant urge to clear it. The tricky part is that this side effect may not appear immediately. It can take weeks or even months to develop. Many people never connect the medication to the symptom. Imagine starting a medication in January and noticing throat irritation in April. Most people would never suspect a connection. Yet research shows this pattern occurs more often than many realize, especially in older adults. If you're still watching, type the word clarity in the comments. Because what we've discussed so far may already be helping you connect dots you've never connected before. And we're just getting started. Because the next cause affects millions of older adults every day, and most don't even know it's happening. Now let's continue with cause number 4, and I want you to pay very close attention because this one may be affecting you right now without you realizing it. Dehydration. Most people hear that word and immediately think, I drink water every day, so that can't be me. But here's what research has discovered. As we age, our sense of thirst becomes less reliable. In other words, your body may already be dehydrated before you ever feel thirsty. Think about that for a moment. You could be walking around every day with thicker mucus, slower mucus clearance, lower energy levels, and increased irritation in your throat without realizing that dehydration is contributing to the problem. Your mucus is made primarily of water. When hydration drops, mucus becomes thick, sticky, and difficult to move. Imagine trying to rinse honey off a spoon compared to rinsing water. That's the difference your body experiences when mucus becomes concentrated. Let me share a story. An elderly gentleman in his late 70s complained that he constantly felt mucus stuck in his throat. He carried cough drops everywhere. He cleared his throat dozens of times every day. When we reviewed his daily routine, we discovered he drank coffee in the morning, tea in the afternoon, and very little water throughout the day. He wasn't intentionally dehydrating himself. He simply wasn't getting enough fluids. After several weeks of improving his hydration habits, he noticed something remarkable. The mucus became thinner. The constant throat clearing decreased. He slept better. His voice even sounded clearer. Was hydration the only factor? No, but it was a major piece of the puzzle. And that's the point I want you to remember today. Most chronic symptoms are not caused by one single thing. They are often the result of several small problems working together. Which brings us to cause number 5. In my opinion, this is the most fascinating and one of the most overlooked discoveries in modern health research. The gut-lung connection. For decades, scientists viewed the digestive system and respiratory system as separate. Today, we know they communicate constantly. Inside your digestive tract live trillions of bacteria collectively known as the gut microbiome. These microorganisms help regulate immunity, inflammation, metabolism, and even communication between different organs. When the balance of these bacteria becomes disrupted, inflammatory signals can spread throughout the body. Researchers now believe that these signals can influence the airways and contribute to excessive mucus production. Think about that. The problem may not start in your throat at all. It may begin much deeper inside the body. This helps explain why some people struggle with chronic mucus despite normal sinus exams, normal lung function, and no obvious signs of reflux. Their immune system may be responding to inflammation originating in the gut. And while research is still evolving, one thing has become increasingly clear. The foods you eat today may influence the way your body feels tomorrow. Diets rich in vegetables, fruits, fiber, and fermented foods appear to support healthier microbial diversity. On the other hand, highly processed foods, excessive sugar, and poor dietary habits may contribute to inflammation. Now here's the moment where everything comes together. Most people watching this video are probably searching for one cause, one explanation, one solution, but in reality that's rarely how the body works. Imagine someone who experiences silent reflux during sleep. At the same time, they're mildly dehydrated. Their mucus becomes thicker because of dehydration. The reflux triggers additional mucus production. Their aging cilia struggle to clear it efficiently. Every morning they wake up feeling as though something is stuck in their throat. Or imagine someone dealing with postnasal drip while taking a medication that irritates the throat. One condition increases mucus production while the other increases throat sensitivity. Together they create symptoms that seem impossible to escape. This is why so many people become frustrated. They treat one piece of the problem while 2 or 3 other factors remain untouched. But once you understand the bigger picture, everything starts making sense. So what can you do starting today? First, avoid large meals close to bedtime if you suspect reflux. Give your body time to digest before lying down. Second, focus on consistent hydration throughout the day rather than trying to catch up later. Third, consider discussing persistent symptoms with your healthcare provider, especially if you take blood pressure medications. Fourth, support sinus health through appropriate nasal hygiene if postnasal drip appears to be contributing. Fifth, pay attention to your gut health. Small improvements in diet can create meaningful changes over time. Most importantly, stop assuming that chronic throat mucus is simply part of getting older. Aging changes the body, but persistent symptoms deserve attention. Your body is incredibly intelligent. Symptoms are messages. They are clues. They are signals pointing towards something that needs your attention. The sooner you listen, the sooner you can begin making changes that improve your comfort, your health, and your quality of life. Before we finish, I want you to do something important. In the comments below, tell me which of these 5 causes sounds most like your situation. Is it silent reflux? Postnasal drip? Medication side effects? Dehydration? Or the gut health connection? Your comment may help someone else who has been struggling with the exact same problem. And if you've made it this far, type the word health in the comments so I know you stayed until the end. I genuinely enjoy reading your stories and hearing where you're watching from. If you found this video helpful, please subscribe to the channel, like this video, and share it with a friend or family member over 60. So many older adults spend years searching for answers to symptoms that may have simple explanations once they understand what's really happening inside their body. Remember this: your body is not working against you. It is communicating with you. Every symptom tells a story. Every change deserves attention. And every small step you take today can help protect your health tomorrow. Thank you for spending these moments with me. Take care of yourself. Stay curious, stay informed, and never stop investing in your health. Because the choices you make today can shape the quality of your life for years to come. I'll see you in the next video.